Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. Praveen P, sadarmin, consultant cardiologist, Narayana Hrudayalaya Hospital, Bangalore. How do we define hypertension? And when should we conclude that the person has hypertension?
Hypertension is a very common problem. So it is like the elephant in the room. Everyone has got blood pressure, and the blood pressure is not controlled. We call that as hypertension or high blood pressure in common terms. So blood pressure of more than 140/90 consistently is defined as hypertension according to the European Society of Cardiology guidelines. But once again, this is not based on just one reading. So we do multiple readings either in the hospital, or we can do a 24-hour blood pressure monitoring, or we can do home blood pressure monitoring. So based on these things, when it is consistently higher than the value I have said, we do call them as hypertensive patients. So these are the ones we need to start some treatment, either pharmacological or non-pharmacological.
What is the prevalence of heart rate in hypertension?
There is a connection between heart rate and high blood pressure, not necessarily a direct one. What we do see is that patients who are anxious all the time, their baseline heart rate will go up. That is natural physiological response when someone is anxious. So anxiety will also cause an increase in the blood pressure value. So when you are anxious, your heart rate goes up as well as the blood pressure. Although there is no direct connection between heart rate and the blood pressure, there are indirect means. For example, when the heart rate is fast, when the heart is going very fast, the pumping may not be as effective as we would want it to be. That is also one of the reasons why we use medicines called beta blockers, which reduce the heart rate and in turn also reduce the blood pressure. So there is a connection between heart rate and high blood pressure.
What precautions should a patient take along with medications?
Regarding precautions, one should be aware that is the most important thing of the diagnosis. You should, because it's like it's a silent killer. You will not know you have high blood pressure until you go and check it. So I would request especially people over the age of 40 years to have a routine blood pressure checkup. It is very simple. Anyone can have a monitor. You can buy a monitor these days and you can check your blood pressure. So get the diagnosis right. Once the diagnosis is there, then there are two ways. One is what we call non-pharmacological, where it involves diet, exercise, controlling your stress, meditation, stopping smoking. So these are the non-pharmacological measures. In addition to that, many patients may require blood pressure tablets to control their blood pressure. Speak to your cardiologist or your physician regarding the medicines and take it religiously without fail. Controlling your blood pressure is very important for the longer term outcome for your cardiovascular disease. So patients with poorly controlled blood pressure are at risk of further heart diseases as well as stroke.
Thank you, doctor, for your time.